Yeah, so we are live. Good morning, Lottie. Is
Good
that how you say
morning.
your name? Yeah. Okay. How are you doing today?
I'm good, yeah. Friday, study day, so yeah,
Yeah.
it's a good day.
I think most people just like to take Fridays as their
Yeah.
study day. Yeah, it works easier.
Yes,
Yeah.
definitely.
So thank you very much for doing this with me. I really appreciate your help. So thanks for coming on the platform. And can you introduce yourself?
Yeah, so my name's Lottie. I'm a third year STP, doing the GI Physiology specialism. I'm based at Wythenshawe Hospital, which is in Manchester, in South Manchester, and I'm doing my university, the MSc portion through Newcastle University.
Yeah. Okay. So, what about your pre-STP background and experience as well?
So I came straight from university. I
Oh,
did an integrated master's in biosciences. So I sort of leaned down the biomed route. So I did an integrated master's. My master's project was related to sort of gut health and things. I was looking at intestinal dysplasia and leaky gut. So that's what sort of took me down into the GI physiology path. I didn't really have any sort of like explicit healthcare experience at all before applying. But I had done a lot of volunteering. So during the pandemic, I did a lot of tutoring for disadvantaged students. I also led a Parkinson's support group as well for a few years. So I think that was sort of useful to me getting on the program as well. And then I did a research internship, working with people with chronic pain as well. So that was sort of my key experience before getting on the program.
yeah, that sounds interesting. It's always good to see the range of experience that we have on the STP because people that always reach out to me, mostly people that are panicking. I don't have any experience when I get on the STP, so I'm
Exactly.
always excited when I see people coming straight from uni. I'm like, so those people are there to see that, yeah, someone else did it.
Yeah.
So yeah, because they can also do it. That's really interesting. So can you talk to us about your specialty, GI physiology? What do you guys do? What's your specialty about?
Yeah, so GI physiology, we look at the entire length of the digestive tract, so all the way from the mouth, all the way right down to the very bottom. And we look generally at functional problems, so all the sort of nasty stuff hopefully has been excluded by the time patients get to us. So we work in tertiary care as well, so that means that you can't be referred to us by a GP. You have to be referred by a consultant. So generally, the patients we see have been suffering their symptoms for years. Very rare that we see a somebody who's got like newly onset symptoms or anything like that. Often they've been dismissed quite a few times. They've been back and forth to their GP. A lot of them have pretty bad experiences in the past. And so by the time they get to us, they are really grateful just to have someone there who's going to actually listen to them and take them seriously. So in terms of the actual problems we see, so up at the upper end, we see a lot of people with swallowing problems. So what we call dysphagia. We see a lot of people with reflux, and we do lots of different tests for people who have got really bad acid reflux. We can then do things called breath tests, which are for people who have got intolerances, so to lactose or fructose or anything like that. And we can also do some tests that look at sort of like microbial imbalances within the gut microbiota. So something called SIBO, which is getting a lot of hype in the media recently. And then at the lower end as well, we see people who have got constipation, who've got fecal incontinence. And we look at the structure and the function of the muscles down at that end as well. We see ladies who've suffered obstetric injuries as well, and we help them with their future pregnancy planning. We can also get involved in treatment. So some of the treatments that we can get involved with involve neuromodulation. So that's things like, we do things like SNS and PTNS, which are ways of stimulating the nerves to try and modulate that great brain gut axis. And then finally, we can do things called biofeedback, which is when we teach patients sort of breathing techniques and physiotherapy techniques to help them sort of, again, rewire that gut brain axis and help with their symptoms a little bit.
Oh my God, there's so much about healthcare that one does not know.
Yeah, things
Honestly,
you never hear of.
I have absolutely no idea what this specialty is about. So wow, that's a lot. So I just have a lot of questions. So maybe I'll just like try to take it one step at a time. So what departments do you work with, and like what other specialties do you work with, and whereabouts in the hospital are you guys? Because it's just amazing what you guys do there.
Yeah, so we're mainly gastro outpatients. We do see inpatients occasionally, but the vast majority of our patients are outpatients. Obviously, primarily, us patients do come through the gastro pathway, but particularly those with swallowing problems, they often come through speech and language therapy or ENT. Those with reflux, again, gastro. We do see patients pre and post lung transplant sometimes as well. So that's when they can come through respiratory, or if they've got acid reflux and making their sort of, asthma or things particularly bad, exacerbating those symptoms. So we do work with respiratory quite a bit as well. On the lower end, colorectal surgery we work very, very closely with. So pre and post surgery for that. And then, as I mentioned before, obstetrics as well. So any who suffers a 3rd or 4th degree tear will be referred for these tests to help them with their future pregnancy planning as well.
Okay. So talking about colorectal, do you also see patients with colorectal cancer?
Generally, that has been excluded by the time that we see them, so they will fall down the oncology pathway. But we do often see patients who have had cancer in the past, and then they sort of get late effects from their treatment. So people tend to get a lot of bowel symptoms following radiotherapy, which is quite nasty and obviously very embarrassing for them. Really affects their quality of life. So that's where we tend to see cancer patients quite often.
Okay. So, sorry, I'm asking so many questions. So, when you see patients, you run some tests. So, specifically, what kind of tests do you guys run?
Yeah, so talking about sort of the swallowing, if I start at the top again, it's easier. So we always go from top to
Yeah.
bottom. So we do our sort of mainstay bread and butter test is esophageal manometry. So that's what we do most of the day. So that's looking at the function of the muscles in the esophagus and looking at how well they're working at moving food down the food pipe. We also do reflux monitoring. So that's when we insert a tube and we send patients away for 24 hours with a diary. They record their symptoms, and the catheter inside the esophagus measures reflux that's coming up during the day and whilst they're eating their everyday foods and things. So we can see what's going on during the day with their symptoms and what might be causing their symptoms. I talked a little bit about breath testing. So that's, again, one of the tests that we do really, really often. And then on the lower end, we do anorectal manometry. So that looks at the function of the muscles in the anorectum. So again, we're looking at pressures there to be able to work out how well those muscles are working. Then we can also do endoanal ultrasound as well, which allows us to visualize the muscles of the back passage as well.
Wow, that's a lot. So then, for someone like you that didn't have any experience before the STP, how then were you able to tailor tailor whatever you've done so far to match the to present a good STP application?
Yeah, I think, as you said interestingly at the start, a lot of people panic, don't they? And I think there's a lot online, people sort of scaremongering, almost saying that, people think, oh, this person had a PhD and they got rejected from the STP, or they've worked as like a band 3, 4 for years and they got rejected. But I really think it's not necessarily the experience that you have, but how you apply it that gets you on the STP. The first thing is just getting through that personal statement part, isn't it? So it's how you present your experience that you do have and how you're able to link it to the specialty. So I think in my case, certainly the fact that I'd done my lab project in the field of gut health essentially was sort of where the academic interest came from, and that's how I was able to link that to why I would be interested in doing GI physiology. Um, and then my other experiences, which I mentioned previously. So obviously the work I did with chronic pain patients, these are also patients that have been dismissed a lot. A lot of the time are told, oh, it's all in your head, things like that. And patients that do need a lot of time, a lot of empathy, you need to be able to have those skills, to be able to listen to them and validate their problems. Certainly that was something that I linked. Similar sort of patients, again, these are the patients we see are generally patients with functional issues. So they do just require that extra bit of time and empathy, really, and not that sort of conveyor belt approach that you get sort of with short tests. Whereas ours, we spend expended time with our patients. So we really need that empathy aspect there. Again, similarly with the Parkinson support group that I led, I think that also tied into my application because I spent a lot of time, sitting with them, making them coffee, talking to them about their problems and just being a listening ear. So yeah, that's the biggest piece of advice to anyone applying to the STP, and I always say this, is don't worry about what experience you have, it's how you can link it to the specialty and that specialty specifically that gets you on the program, I think.
Yeah. So because your specialty is patient facing and you had a lot of volunteering opportunities that are patient facing, do you think it helped that you were able to talk about how you are able to manage being in a patient facing specialty?
Yes, definitely. Yeah. And it was actually my master's lab project that put me off lab work, to be honest. I felt like I needed humans. I was working in a Drosophila lab for a year and I got a bit fed up of counting flies.
Like, I think that's just the different aspect of it. For someone like me that is used to working in the lab and behind the
Mm,
scene, I'm definitely going to panic if I have to get into a patient-facing role. So yeah, it's difficult for you guys that are used to being around patients not to be there. So yeah, that
yeah.
makes sense. So what about your interview? How did you find your interview?
So this is something I also wanted to talk about. So I live right on the, I'm from originally right on the border between England and Wales. So I applied to both the English and the Welsh STP, and they have slightly different application processes. So in England, I obviously applied for GI Physiology and was successful. In Wales, I applied for neurophysiology.
Mhm.
They have a slightly different application process in that you don't have to do the situational judgment test. You do your personal statement in around February time, so it was just after the English one was due in. And then it was an in-person panel interview in South Wales for the Welsh STP, but it was actually in April. So that was really, really good preparation for me, actually, because it was a very similar format. Unfortunately, I wasn't successful, but I was really glad just to get to the interview stage for that one, to be honest. And I thought all along that my heart was in GI physiology, so I was quite glad to get onto the English one. But certainly the one in Wales really, really helped me with preparing, and I kind of worked out where I went wrong in the Welsh interview process. So it was a very similar format with the questions that you get, sort of like the general leadership ones, don't you? And things like that. And then the subject specific. So certainly going into my English interview, I spent a lot more time preparing, sort of looking at patient information leaflets. So I had a really good understanding of what the tests were about, which was something that I probably didn't do so well for the Welsh one.
Oh, that's a good one because I think recently when they did one for the Wales one, I had a lot of people asking me questions about the Welsh one. I'm like, I can't answer you because what I
Mm,
did is just the English one.
yeah.
So, but I think they were mostly genomics applicants. Did you have to take an exam or something?
I didn't know. The process is slightly different there. And certainly like GI physiology wasn't even an option in Wales. So there were certainly a lot less specialisms. I don't know whether maybe was an exam for specialism.
The Wales one, that means it's not a general application like the England one. You apply specifically to the department, or how does that work?
No, I think, gosh, you're really testing my memory now.
So
I
sorry.
It was still sort of a nationally set application process, I believe. But I think, on track jobs, which is where most NHS jobs are advertised, I think you did apply to the SDP program for that specialism on there, if you get what I mean. Rather than,
Yeah.
I know obviously for Oriel, for English SDP, you apply all on the same platform. You just tick which specialty you're applying to, don't you? So, but I would really recommend that to apply to anyone, even if it's just for interview experience, to get onto the English one, because the Welsh interviews always fall before the English.
Yeah, that makes sense. It's a good thing. It's a good one. So thank you for sharing that. And again, most people that are applying or watching the videos, they are always interested in knowing specifically what the role of a clinical scientist is, because it's one thing to understand the specialty, and there are different roles within a particular specialty. So since they are applying to the STP, of course, they need to understand what the role of a clinical scientist is. So can you talk us through specifically what the role of a GI physiology clinical scientist is?
Yeah, so within GI physiology, I guess we're a little bit unique, isn't in that most departments, certainly within the physiological sciences, they do have a lot of sort of band 3, band 4 support roles. Whereas in GI physiology, it does tend to just be us, the clinical scientists. So it is very much us performing the tests, analysing the tests. So I guess that's the mainstay of our job role, and all of the tests that I've previously listed earlier on. You do get sort of HCAs and support workers occasionally in some departments. My department, we personally don't. We do everything ourselves. Certainly attending MDT, you've got to, if the consultant or the rest of the MDT don't understand the test results, and you're expected to sort of be able to talk them through what the test results show, what they might be suggestive of. If there's any interesting test results that required a bit more in-depth interpretation, then you'd certainly be able to define those and sort of advocate for the patient in that way. I think the main role of the clinical scientist within GI physiology is to just stay on top of all. It's a really, really rapidly evolving field, really. So you've got to be on top of all the latest guidelines and recommendations for various conditions. And certainly it's one of the lesser The consultants don't tend to be that interested in it. That's the easiest way to put it. So you are
Mhm.
really advocating for those patients, and particularly as they're often patients that have been dismissed a lot in the past and not being given the empathy that they need. It does feel like a big responsibility almost, and it's really fulfilling and rewarding in that way to be the people that are finally advocating for them.
Yeah, yeah. That's a good one you guys are doing there. Then as a trainee, because I know the role what a trainee will be doing might be different from what a clinical scientist will be doing. So as a trainee, can you talk us through what a day in your life is like? What sort of things you actually it's actually surprising some sorts of question I get that made me realize that. And also when I was applying, I also realized that I actually don't know what trainees do on daily basis. So if you can tell us about some things you do daily, and if possible, if you would like to, you can run us through a week if a day might not cover everything that you do.
Yeah, so obviously it varies quite a lot during the program, as I'm sure you found with your own experience, that in your first year, you're often about everywhere doing your rotations.
Yeah.
It's really nice when you get into your second year and you finally actually settle into your department and start to feel like you're at home and start to feel like you're part of the actual team. So yeah, first year is very much about doing rotations. For GI physiology, that's respiratory and urodynamics. And then also there's the clinical assessment and investigation module. So they get you to go to like A&E and get you to go to critical care. Just shadow lots of different areas of the hospital to try and widen your experience a little bit. Then getting into second year, that was when I started to actually learn to perform some of the tests. So I started off performing breath tests, as those are the most simple ones, really. Obviously under supervision originally, and then when I was competent enough to perform them by myself, and now I am performing those by myself. And then starting to perform some of the other tests. So esophageal manometry was probably the next one, given we performed so many of those. So just training initially under supervision and then more independently, which I am now in third year. And obviously across the board for those tests. Now I'm in third year. It's more to do with sort of like filling those gaps for what I need to learn before I qualify, because it's coming up really soon now. So yeah, filling in the gaps of the tests that I have less experience of, or just that my department doesn't really have the same strength or expertise in. So I'm visiting other departments. So I'm going over to Alderhay Children's Hospital at the moment to learn paediatrics, and I'm going over to the Women's Hospital to learn more about sort of the obstetric side of things, as that's their specialty, obviously there. So third year is also a good time, I think, really to start pursuing some of those interests and trying to find out specifically where your expertise is going to lie and where you can take that forward. And then obviously there's the research project as well.
Exactly.
That big looming thing, yeah. So I've already done my data collection for the research project, so I'm really glad that's out the way and done. So I was looking at acid reflux in people with cystic fibrosis. So I had to recruit people to take part in that study. Recruitment took a long time and a lot of effort, ringing people up,
Yeah.
trying to persuade them to
Yeah.
take part, even though it was a really simple study.
How many people were you looking at?
So I had 40 in each group, so 40 in the controls and 40 in the CF group. But they were people who were already attending for the test, and I just needed to persuade them to sign up to take part in the study and do a cough and a big breath in. But trying to persuade people to do a cough and a big breath in can be a bit
Alright.
more difficult than you'd expect. Yeah. So now I'm obviously in the analysis stage of my research project. So it's just trying to keep on top of that and competencies and everything else. So it's a lot of
Yeah.
spinning.
Yeah, there's a lot going on at the same time. So for having so much going on for you right now, how are you able to balance everything right now?
I think prioritizing is the main thing. At the start of each year, I found that I sort of set my university deadlines in the calendar, any other deadlines in the calendar. And then I almost look at each month and almost set myself a priority for each month, because I'm sure you found the same, that during the STP, your priorities have to change. Sometimes you're really into the university work, revising for exams. Sometimes you need to stay on top of those. So I find it easier to try and have one main focus at each time. And that's how I've got through so far. It is
Yeah.
difficult though, especially when life happens on top of everything else. Everyone has a life outside the STP, and sometimes that's really complicated as well. So trying to
Yeah.
balance it all is hard. But it's certainly doable. And I think with the correct sort of prioritization and reaching out for support as well. There's been a few times where I've reached out for support. I'm lucky to work in a really, really supportive department. The school are always there and the university are always there as well to help you get through. I mean, everyone wants you to do well at the end of the day because they're investing so much in you, sort of resources wise, money wise. So they do want you to do well and get the most out of it, really, at the end of the day.
Talking about having life happening at the same time, it's almost impossible to separate the STP from your own life. It's different when you have a job, you've
Yeah.
clocked out and oh, I'm done for today and you're home. I find myself sometimes like arranging in my head, well, when I get to work tomorrow, I'll do this. I'm like, stop, try to
Yeah.
just stop. Can't stop. Maybe I've gone so far in my thought and I'm like, oh God, I just need to be at home and stop worrying about this thing. It's actually difficult to separate it, honestly.
Very hard, yeah. It's also trying to force yourself really to only do work during working hours and really make the most of those study days as well and not just waste them away. You do need to make the most of them. And I think particularly obviously around exams, it is very tempting. And you should
Yeah.
really, if you can, obviously revise at the weekends and things, but it's easiest than when you've got 101 other things going on in your life. So yeah, it's just maintaining that balance, isn't it?
It's almost impossible to win over the exam time because when you're not fully prepared, you find yourself, I'm just gonna read a little bit
Yeah.
both at the weekend and at night. But I think it's part of what makes the STP what it is. That's the experience. That's the life of a trainee.
Mm.
That's what being a trainee is. So yeah, letting people know this is what it's actually like. I think it makes it better. So when you find yourself in that shoes, you're not shocked. You would have heard it somewhere that these things happen to trainees. So yeah, it's all good.
Yeah. And also the supernumerary aspect. I think sometimes you do have to play that card a little bit and say, look, my training does need to come first. I'm really sorry. I am supernumerary. I can't take XYZ patient today or take on extra workload. Because otherwise it does just get too overwhelming and your department shouldn't be sort of relying on you to
Yeah.
do more than what is expected, obviously, in the supernumerary role. But yeah, playing that card is quite hard sometimes. So
Yeah, that's also an interesting part that you just brought up now. So yeah, I was going to ask you, but I almost forgot. So thank you for bringing it up. So for you, for someone like you in a patient-facing role, and now you've started doing some of those tests, and I think you mentioned earlier that you get to do them independently and all that. How do you actually balance it? Do you have like a set day of the week where you maybe contribute to service work, you see patients and all that? Then you have other days where you do your STP work, or do you just take it as it comes? If you feel you are very busy, you let them know that, oh no, I can't do this. Or I don't know, how does that work for you?
So I'm very lucky that I work in a department that basically just lets me do what I want to do. But I also feel like that's been built through almost like trust, that they know that I'll get my work done and that I will help out when I can. And when I can't help out, I genuinely can't. I've got too many other things to do. So I think I've had a very positive experience of that. So it's almost like on the day, each day. I'm not really factored into the staffing rota unless there's obviously people on annual leave or sick, then that's when I will come in and fill those gaps. But on a day-to-day basis, certainly I'm not, I don't have patients allocated to me or anything. It's very much up to me. And it's almost like if I'm, helping out, it's out of the goodness of my heart to try and help people, which
Mhm.
I do, obviously, of course. But yeah, I know other people don't have as supportive departments necessarily as I do, but I have been very, very fortunate. And yeah, it's just trying to advocate for that really to build yourself an environment where you're trusted to just get on with your work and
Yeah.
that they know that you will help out when you can.
I think having a supportive department makes the SCP less
Mhm.
stressful because you have to
Yeah.
just give it all you have, and then knowing that you have people there supporting you makes it better, kind of.
Yeah, definitely. Yeah.
Okay, so for someone in third year and you're going to qualify soon, how has your confidence grown over the years?
Enormously. Yeah.
You think you are more confident as a scientist now?
Yeah, definitely. And it's crazy to think probably like this time last year, I feel like I've grown so much since then. And then probably, a year from now when I'm qualified, I'll feel like I've grown even more. It does take time. There's definitely everyone experiences imposter syndrome when they first start, and I'm certainly still getting it now in third year.
Okay.
I think it's easy to hyperfixate on the things that you don't know
Yeah.
and hyperfixate on sort of like your weak points. But certainly when you come into the STP, there are people who come in with a lot of experience. And there's also a lot of people that come in with no experience like me. And there's certainly no expectation on you. It's a very good program to build you up from the bare basics, assuming that you have no knowledge. And the whole structure of it really is that you start with your rotations, don't you? Really sort of find your feet, get to know the specialty, and then it's only in those second and third years that you're really expected to kind of find your niche and get good at it really and gain in confidence. But yeah, I think the program is structured well in that way to help you grow. And also recognize your scope of practice as well. They love to hear that, don't they? That you're not going to be on your own, independent, running clinics in your first year, are you? Because that's not safe. So
At all.
so yeah, I think you do just have to remind yourself, and I certainly did as well. Sometimes I'd beat myself up and then I'd be like, no, I'm just a first year. I've come in with no experience. And yeah, keep your expectations and just manage yourself and take it slow. It's a marathon. My
Yeah.
manager always said that to me. It's a marathon, not a sprint. So
It's I always appreciate the structure of the STP, and also when I get to speak with people from other specialty, I realize like we're all passing through the same thing and we kind of have the same experience, the imposter syndrome of feeling like you don't know anything. But actually, if you sit down, you realize that you've actually learned so much and you are becoming better and better. So it's also good for people out there to know that imposter syndrome is real, but you get better over time. The program is so structured that it builds you. You find yourself using the terminologies that you found difficult in your
mm,
first year. You find yourself putting it all in together. So yeah, I'm really grateful for the STP really. I don't know about others, but I'm really enjoying the program. Though it's very intense, but
mm.
we're getting there.
Yeah. Something I remember talking to the first years about last year is I remember coming back from that big uni block that everyone has at the start of their first year and just being like,
Mhm.
whoa,
Whoa.
completely
Yeah.
overwhelmed because they do just dump everything on you, don't they, for 5 or 6 weeks. And you just got to trust you're going to be living it, breathing it every day until your exams and you will just know it. I think when it
Yeah.
came round to revising for exams, I was really shocked how much I
Yeah.
did know just because I've been doing it every single day. So obviously,
It makes a lot of difference when you start the first part of the uni and they dump all that information on you. Then you get back to the trust and you start saying, "Oh, this is what they were talking about. Oh, this is this." It starts to make sense. It's all clicking,
yeah,
and you're dotting the i's and crossing the t's, and you're like, "Oh,
exactly.
yeah, that makes
Yeah.
sense." Well, it's all good. So, okay, I'm going to ask you to give two advice. So, the first one would be for people that are applying to the STP. Of course, January is almost here, so I'm sure the 2026
Mm.
applications will be rolled out soon. So for people that are applying to your specialty, what advice would you give them on how to present an outstanding application?
Yeah, I think the biggest piece of advice is link everything back to why you want to do that specialism specifically. So for me, for GI physiology, some really sort of, I guess, like the unique selling points of GI physiology is that you get to spend a lot of time with your patients. You're really making a difference to quality of life. So it's less about saving lives and more about actually making a
Improve.
difference to people's quality of lives. And you see a really tangible impact with that in GI physiology. And people are often crying in tears because they're just so grateful that you're finally listening to them and finally helping them. So that's certainly something that you can always tie back to in your statement and in your interview as well. And also the fact that it's an evolving field, it's a really exciting area to work in. There's obviously a lot of good and bad information in the media, and there's a lot of companies making a lot of money off the gut health, etc. But it's still exciting just to see it around so much. And there's so much research and so many new technologies and so many new guidelines coming out. It's really rewarding to work in a field that is getting so much attention. So yeah, certainly overall, biggest piece of advice in your interview and your personal statement, tie it back everything you can. And that sort of leads back into not worrying about what experience you've got. It's just use what you've got and tie everything specifically then back to why you want to do GI physiology.
Yeah, that's straight to the point. So thank you. Then secondly, for persons that are starting the STP, let's say people that started last September, new into the field and facing everything, wondering how they are going to manage everything, what advice do you have for those sets of people?
Try not to worry. It's probably the
That's
biggest
impossible.
thing, yeah. I think you'll really surprise yourself, and I like the fact that you asked that question about confidence, because I think it's so overwhelming when you first start and you go off to that university block and they just throw loads of information at you. You come back and you've got all these rotations to do. You don't know what you're doing. Trying to just organise rotations is so difficult as well, and experiences get a lot of ignored emails. So I would just take things logically, make a plan, and certainly something that I said earlier that I found was just work out what your priorities are going to be almost each month. So if you've got exams in the summer, then you know that like May you're going to be revising. Generally, most people find that sort of June, July, August time is your main time to focus on getting those comps wrapped up for the year. So yeah, make a plan and just sort of trust the process almost. I know that sounds such a cliche, doesn't it? But when you first start, you are going to feel really, really overwhelmed. And I promise you, you are going to be like living and breathing your specialty every day. So when it does come around to exam time or competency time, you'll be so shocked how much you've done and how much you've picked up. Subconsciously, because you're just doing it every day and you're just learning constantly without even realizing it.
Thank you. Then you mentioned organizing your rotation. I spoke with someone this morning, I think from Vision Science, and she also talked about organizing your rotation. So for you in your first year, do you have to email those departments and arrange your rotation yourself, or your training officer would do that for you?
So I think I emailed and arranged everything myself. Yeah, I did. There was a little bit of guidance from my department, but it was pretty much left up to me to sort out. And I work in a department like most GI physiology because we're a very small specialism where I didn't have sort of like an STP in the year above to follow or anyone else to follow. So it was left up to me to organise. For example, urodynamics, I had a bit of a problem organising that rotation and I ended up emailing the lecturer from Newcastle. So this is something I'd recommend if people are having problems. And they pointed me in the direction of somewhere that I could go to do my rotation and they helped me out. So if you are struggling, that's always an option. Or try and find STPs in the years above you and try and work out what they did as a sort of a blueprint. Even if it means going to another trust and organising an honorary contract, it's worth it. So
Yeah.
yeah.
Yeah. I think that's a huge difference from mine because for me, everything was organized by my training officer.
Right.
And I don't know, probably because we usually have a lot of STPs in genomics and every other year after year we have people coming in. So there's already that structure of you have this huge training plan from the training officer. I know that this particular month I'm supposed to be doing this rotation and he sends all the email, everything is planned and organized. Then I get that email from someone, oh, Cynthia, I'm expecting you on this day and this time. And all I have to do is just show up. So,
So
yeah,
this
so
one
that's a
doesn't
huge
work for you,
difference.
yeah.
Yeah, so everything is all worked out for me. I just get my bag and find myself to where it's been planned for me. So, yeah, that's a huge
That's
difference.
hard
But
enough sometimes though, isn't it? Just finding the place that you go into.
yeah, you're just there wandering around the hospital. Oh, where I'm looking for the
Yeah.
first year. First year is just unbelievable, but it's an interesting experience. Right now in second year, you have so much to do. Then I look back when I was in first year, I'm like, oh, I miss first year
Yeah.
because you don't have so much responsibility. But when I was in first year, I was worrying myself, panicking, battling imposter syndrome, and now I miss first year.
Yeah, it's difficult, isn't it? There's pros and cons because, of course, in first year you do, sometimes you sit in the corner and you just feel like a bit of a spare part sometimes, don't you, when you're shadowing things. And
Mm-hmm.
I love the fact now that I feel like I'm such a big part of the team and I'm really contributing in my own way. But certainly I do miss the sort of sitting back in the corner and just watching. Because I
Just
did first
watching
year.
everybody and
Yeah,
ask you a question. Oh, I'm supernumerary. I'm
yeah, exactly.
supernumerary.
I'm just a
But now you
trainee.
need to now you have to get competence, start contributing to service work. But it's all good. It's
Yeah,
been lovely speaking to you.
thank
Thank
you
you
very
so
much.
much for coming and thank you for all the advice and I'm really grateful. So thank you very much.
Thank you. It's been great, and best of luck with your second year in genomics. And
Oh, you too. Best of luck to your final year.
thank you.